If you've been dealing with neuropathy for a while, there's a good chance you've tried things that gave you temporary relief, but they really didn't actually change the problem. There's a reason for that, and once you understand it, you'll see why this approach is different. Most treatments focus on reducing symptoms, calming the pain, numbing the signal. For some people, this can really help in the short term, but it doesn't necessarily improve how the nerve is functioning. It's like turning down the volume in a fire alarm and never fixing the wiring that's causing the faulty alarm to go off. That's why people don't see lasting change. To improve neuropathy, 3 things need to happen. First, you have to improve blood flow to the nerve. Second, you have to restore energy to the nerve so it can repair. And third, you have to retrain how that nerve communicates with your brain. Most treatments only address one of these at a time. We built our entire system to address all 3 of these at the same time. But here's the part most people miss. Change doesn't happen from something you do once or twice a week. It comes from what you do every day. And that's why we partnered with a system called the Nerve Reviver System. This is so you can work on your nerves daily. We do this through a simple, structured approach for you at home. If you are only coming into the clinic to see us, you might get 2 sessions a week. That's about 6 to 8 hours of treatment a month. But when you're doing this at home daily, now you're getting closer to 40 to 50 hours of treatment in that same amount of time. That's a completely different level of stimulus for your nervous system. And your nerves respond to repetition. This is what allows your body to actually start changing. It helps you consistently improve circulation, stimulate the nerves, and reinforce healthy signaling. Because your nerves don't change from occasional treatment. They change from consistent input. Now, once the foundation of daily home treatment is in place, we can take things even further. This is where our in-clinic technology comes in. We use coordinated technology stacks. We use these to accelerate the exact same process you're already doing at home. We use therapies like photobiomodulation and specific forms of vibration. We use those to increase blood flow, improve oxygen delivery, and support the small vessels that feed the nerves. Some of these therapies have been shown to significantly increase blood flow, which is critical to the nerve repair. We use multi-waveform electrical stimulation to activate nerves, to improve communication, and to restore cellular energy. Multi-waveform direct current has been shown to increase cellular energy production by up to 500%. That's what allows your nerves to actually begin recovering. We also use targeted sensory input to improve balance, to help your brain reconnect to your body, and in some cases, we add focused shockwave to stimulate tissue repair and nerve recovery. Research shows that patients receiving this type of therapy are more than twice as likely to see meaningful improvement. Individually, each of these help, but when combined with your daily homework, they accelerate your progress. At your first visit, we're going to evaluate what's actually limiting your system. We're going to determine exactly what combination of tools and strategies you need. Whether you go through this independently at home or with a more guided in-clinic support, the goal is the same: to help your nerves function better, not just feel better. And that's what makes this different.